Hi, today I want to talk about mesalamine, a drug that is used to relieve symptoms of inflammatory bowel disease, primarily on ulcerative colitis. The pathophysiology of this disease is it is an autoimmune disease in nature that causes inflammation affecting the mucosa and submucosa. Those regions are very vascular and the inflammation causes bleeding. It starts within the rectum and continues the inflammation proximally through the large intestine. My top three assessment for a patient with this disease will focus on bleeding because the inflammation causes bleeding that can be seen in stool, so observation of stool color, and also keeping in mind that the patient is at risk for anemia. The second one would be diarrhea, inflammation affecting GI absorption, reduce the time for water to get absorbed, leading to liquidy stool. So I will assess for amount and type of the output and also the inflammation, put the patient at risk for megacolon and severe diarrhea, put the patient at risk for dehydration. The third one would be tenesmus. It is a unique symptoms in UC that causes rectal spasm. I will do this assessment by asking the patient if they have feeling to pass the stool, but nothing comes out because the bowel is already empty. I understand that this medication will treat this disease by saying that affected area causes release of prostaglandin and many inflammatory mediators, increasing the inflammation within the affected area. This medication will inhibit the activity of cyclooxygenase, which is responsible for formation of prostaglandin, thereby reducing production of prostaglandin, so reduce inflammation activity. My top three priority concept for the patient on this drug would be the first one is fluid and electrolytes. Patient in this drug could possibly experience nausea, vomiting, and diarrhea as the side effect of the drug. So losing fluid and electrolytes through it. The disease also causes diarrhea. So with this drug, we want a balanced fluid and electrolytes. Second one would be tissue integrity. I will prioritize this concept focusing on epithelial or skin because common side effects of this drug also include rashes and itching, causing lesions and open wounds that put the patient at risk for infection. The third one would be perfusion. I will prioritize this because of the disease causes bleeding that can affect the perfusion in the body. The drug reduce the bleeding, so get perfusion in the body. Before administering this medication, I will assess for allergy because severe allergic reaction can occur. And the second one would be if the patient have a pre-existing kidney disease because the drug can affect kidney function. I will do this by going through the lab work, including BUN and creatinine level, and also going through the chart by recognizing the main diagnosis for the patient. After administering this drug, I will assess for therapeutic effects, reduce the sign and symptoms of the disease include pain, bleeding, and diarrhea. I will also assess for side effects such as dizziness, headache, nausea, rashes, and serious side effects such as pancreatitis, nephrotoxicity, and Stevens-Johnson syndrome. Assessment finding that will indicate the drug is working effectively is reduce of bleeding in GI, so observation of stools or conducting occult blood tests as needed would be my assessment. And then the second one would be reduced pain. Pain is caused by the inflammation in that affected area. I will do this assessment by conducting OPQRSTU pain assessment and also follow up with sigmoidoscopy as needed to find out how the disease is resolving. The assessment finding that would indicate the drug is not working properly would be increase and more inflamed area as compared to before. The inflamed area is moving through the large intestine. Assessment that could be done such as conducting OPQRSTU pain assessment and from sigmoidoscopy. The second one would be not resolved bleeding. Some assessment include going through the complete blood count for hemoglobin and hematocrit. Other would be still seeing blood in stools. The patient is pallor and has low blood pressure. These arrows connects the idea in this mind map. The first one connecting the disease and how the medication can resolve the symptoms of this disease by what mechanism. The second one would indicate the relation of disease and priority assessment, finding what would be the risk for the patient. The third one would be initial assessment compared to after administration of the drug assessment, seeing the therapeutic effect we want for the patient. And then the fourth one is how the concepts relates to the disease, such as bleeding that is related to perfusion, and diarrhea is related to fluid and electrolytes. Thank you.